This particular day, I wasn't feeling well at all, and my wife, Debbie, who's a nurse, said, "You really ought to see a doctor."
I met Bernie in the intensive care unit. He had a large amount of fluid in the sac around his heart, which was causing him to have low blood pressure and become very critical. So we stabilized Bernie. But Bernie had atrial fibrillation. And with atrial fibrillation, you increase your risk of stroke fivefold.
Because of the bleeding situation in the pericardium, Dr. Lotfield and Dr. Fox didn't want to put me on a blood thinner, and they were telling me about a new procedure called the Watchman.
Bernie was our first Watchman patient. With the Watchman procedure, you very carefully deploy the device into the left atrial appendage, which has the most likelihood for a clot to form in people who have atrial fibrillation.
The procedure has really improved my outlook and my overall well-being. My worries about stroke are probably reduced by 97-98%. I do what I can. I'm an active volunteer at the Vintage Radio Museum. It's not too bad for an old guy.
It's the respect for Bernie as a person, as a human being, and listening to him. That's the mark to me of a good team.
When you have a relationship built on trust, patients and their family can really express their feelings. It's not about the procedure, it's about them.
I am sincerely so grateful to this hospital because I don't think we would have had the last 2 years that we've had together.
We're living in an amazing time.
Bay State Health. Advancing care, enhancing lives.